So I've actually learned three big lessons during this past year related to public health and this COVID-19 global pandemic. So the first lesson I learned is that we can actually collect data about racial inequities in real time at a national level. So, in the beginning of the pandemic, they were not necessarily reporting cases based on race, ethnicity, and gender. And that was going to be a problem because health equity researchers, we knew that this pandemic was going to disproportionately impact communities of color, which all health issues, all health diseases disproportionately impact communities of color, and we knew that COVID-19 was going to be no different. So to see, House of Representative members and activists and academics lobbying to make sure that data was being collected and reported based on race, ethnicity, and gender was really an important contribution. So when you can actually collect that data in real time, you can see what's going on and you can better impact what's happening in the now. A lot of times when we're looking at health equity issues, we're looking at data for things that have already happened, and then we're trying to find solutions to fix the things for people who might come afterwards. But having real-time data about inequities allows us to intervene quickly and in the moment. And so those inequities were existing based on diagnoses, based on death, mortality rates. And then, of course, once the vaccine was developed, we knew that communities of color would lack access compared to white communities. And of course, that happened too. And it played out in real live time. And I think because so many folks were aware and were reporting about this, it just raised our collective societal understanding about racial disparities in health. The other thing that I really noticed was, the impact of talking about structural and systemic racism as it related to the COVID-19 pandemic. A lot of folks said, we're living in two global pandemics right now, racism and COVID-19. So there was this interesting intersection of we need to be safe, we need to stay home, but we also need to be advocating and fighting for racial justice, especially, with the egregious collective witness of the murders of George Floyd and Ahmaud Arbery and Breonna Taylor as well. The third thing that really struck me with respect to what I learned during this time and public health was what we can accomplish when we, break down these barriers to improving and increasing knowledge. So the reason that the COVID vaccine was able to be developed so quickly was because, first of all, Dr. Kizzmekia Corbett, she was already working at NIH in a lab to find solutions to coronaviruses, and they had been working on the mRNA, the messenger RNA technology, but that both the Pfizer and the Moderna vaccines use. And so that was already happening. But what also was critically important to this quick development of the vaccine was a lot of the barriers and the ways that we structure new knowledge formation in our pharmacology world. A lot of those things were broken down. So people weren't hoarding, the information about the coronavirus, about COVID-19. They were sharing it. They were sharing it widely across the globe. That meant you had scientists all over the world doing their best to figure out a solution to this problem. And the other thing is, a lot of times these labs have to fundraise money in order to be able to do the research and to recruit people into the studies. But there was a ton of money that was being donated in the cause of finding a solution, finding a vaccine for COVID-19 because it was impacting our entire global society. So just imagine, how much more leverage, how much more productive work we could do in the field of health and wellness and medicine if we started to break down some of those barriers in more consistent ways outside of, when we have a global pandemic, but for cancer and for HIV and for other types of health issues that are disproportionately impacting communities of color and low-income communities as well. So there was so much to learn about, what's possible through this COVID-19 global pandemic, and I hope that we embed some of those lessons that we've learned into our future.